Hi everyone, I'm here to do a quick Foley video for you. I hope you're enjoying your spring break, but I realize you only have 1 week to do your competency checkoff practices, and that's during spring break of course. And so the first week we'll come back, we do have your Foley and trach checkoffs, and I want to make sure that we're all on the same page of how to do that Foley and trach checkoff. So while you're soaking up the sun or snow, take a few minutes to review this video. Hopefully it'll be under about 10 minutes to show how to put a Foley in. So going based off your checklist, first thing we do is we're going to check our physician order and our policy to make sure we're following Methodist or Norse or Riley's way of putting in a Foley. And then we're also going to, at that point, gather our supplies. Important items that you're going to need. Make sure you have hand hygiene available at bedside, have regular gloves, have peri-wipes, and you also are going to have your catheter kit and a bath blanket. Make sure with our bath blanket, we're going to make sure our patient is draped so we can easily access the vagina to put in our Foley. Alright, so first thing we're going to do is knock on our door. Knock, knock, knock. This is our patient, Ms. Johnson. I'm going to introduce myself. Hi, Ms. Johnson. I'm Emily, the nurse. I'm going to put in a Foley today. It takes about 10 minutes. Hopefully it'll give you some relief from your abdominal pain you're having today. Do you have any questions for me? No? Alright, that's fantastic. I also want to make sure my safety checks in the room are performed. Nothing's in my way. Bed's at a working level. And I'm not going to have anything that can interfere with my sterile procedure. As I'm putting my stuff together, make sure I close the curtain, make sure that I provide privacy for my patient, and at that point, again, we have hand hygiene, and we're going to clean our patient. And at this point, when we're going to clean our patient with their clean gloves, we want to make sure that we are going to check for a few things. First thing is mobility. We also want to check for the ability to follow commands and their level of awareness, because if they are going to be kicking or moving their legs, then or not able to hold their legs up, we may need additional support at bedside, like additional staff. And we also may need to create our sterile field on our bedside table in order to not have it broken if the patient's going to be moving around. Other items we want to check for while we're cleaning the patient: redness, swelling, any drainage, and a distended bladder, which would be above the symphysis pubis. And when you're using these, as I'm just going to show you the package because I know we've already practiced these in lab, make sure you wipe front to back for our patient, get any transient or residual flora off of our patient, and keep them nice and clean because we don't want any of that bacteria getting near our Foley catheter and causing increased infection to our patient. Alright, so we're going to discard these gloves and again do hand hygiene one more time, and then we're going to actually begin the Foley kit setup. So with the Foley kit setup, we're going to have our trash can with our, this is going to be our trash can, excuse me. Goes over right here. And this is just going to hold any trash that we may have. I'm actually going to move this a little bit closer to me. And then this is opened up toward me. Remember, we always want it to be away from us. So I'm going to kind of flip it and open it up. At this point, I want to make sure I'm going to pull back my drape for my patient. And because then at this point, we need to actually grab our drape for our kit. And I can see I have an exposed end right here. So I'm going to lift it up, let it open to air. Shiny side goes down, my friends. So at this point, I want to place it underneath my patient as best as possible without breaking any sterility. And this kind of opens up a workspace for me that contains the sterility of my field. And then I also want to turn on my gloves without pulling my back away from my site. I'm going to set up a little field here. Make sure I maintain sterility with my site while I'm putting on my gloves. Remember, you're going to grab the cuff end, lift it up, place your hand in. Oh, shoot. If this happens, guys, I'm just going to continue going with this video. At this point, I need to grab a new glove. It's not sterile, but for purposes of time and for purposes of product, we're going to keep moving. And then keeping my hands above the waistline to make sure I maintain sterility. Next piece is we're going to grab our fenestrated drape, which goes over the vaginal or the penis. When again, we want to make sure we find our shiny side. And we're going to drop it down and make sure we maintain sterility. And then we're going to finish setting up our tray. What I personally like to do is I like to kind of move this box up and move this down. We need to ask our patient, do they have any allergies? Allergies are incredibly important. We want to make sure that they don't have allergies to latex, betadine, iodine, or shellfish. Why? Because this product has potential for latex, and this also has betadine within it. So we open this up on the slit right here, and we're going to put it on our cotton balls. Sometimes your kits are going to have actual swabs that you would pull out one after the other. Either way is appropriate. Just make sure we're not putting a patient that has an allergy to betadine onto our patient. The next item, we need to finish setting up our tray. So we're going to use our lube. Don't forget, for lab purposes, this is soap. It is not the actual lube inside of it, because our mannequins do not do well with that. However, please ensure that you use all of this, but for purposes of practicing in lab, I'm not going to waste all of our dish soap. I like to remove my catheter tip at this time with my plastic wrap, but make sure you do not pull it out so it flings everywhere. That would not be good for our patient to have a catheter that's been exposed to maybe the surrounding air. So I'm going to have all of this connected. And then finally, I want to make sure I have my my water, my distilled water, saline, connected to my balloon inflation site. Remember, this piece right here will tell you the size of how much water should go into the balloon to inflate it once it's in the bladder. It'll be a 10, can be 5, can be 30. Just make sure you're putting in the appropriate French size for your patient and the correct amount according to the packaging equipment. All right, so everything is set up. I've maintained sterility. I'm going to break sterility with this hand by holding open the labials, and I'm going to clean. Please note, these will have betadine on them, so we're going to wipe front to back, and I'm going to get rid of it, staying away from my sterile field. The biggest piece, guys, is we don't go back over ourselves. Just like this, we don't go back over our field. So we're going to go from the right side, and then finally one time down the middle. As you're seeing this, guys, you're going to notice like a little slit, or you're going to start to notice a little hole where the betadine is going to go further down. That's what you're looking for, is you're looking for the site of where you should go, because sometimes the anatomy is not going to be what you expect it to be. If, for instance, you do not get it on the first try and all of a sudden you've pushed it in and nothing's coming out, it may be that you're in the vagina and not the urethra. Totally okay. What we're going to do is grab a new kit and we're going to leave it in place and grab a new one. All right. So I know that I've cleaned it. I've seen the site of where I want to go. I'm lubed up, ready to go. I see my hole, and I'm going to say, Miss Johnson, take a deep breath and bear down. Great. And then I'm going to insert without touching my catheter. All right, so I've met resistance, and what I'm actually going to see on my real patient is from this clear area down here, I'm going to notice urine return, which is phenomenal. I'm keeping hold of my catheter so it doesn't come back out at me, inflating my balloon, and then I can disconnect it. Other items from here is I want to, this point, this would be ripped. I would be taking this bifurcation and I would be connecting it to my patient. However, I don't like to do all this in these sterile gloves. I like to do hand hygiene at this point. One more time. And I'm going to actually grab a new set of clean gloves. So this point would connect, I'm gonna go ahead and, I'm not gonna rip this for purposes of lab so we can keep using our items, but this piece would be connected to their inner thigh. I'm gonna take my bag and I'm gonna put it below the level of the bladder onto the bed. Make sure it's not on any moving parts. We'll clean our patient up, remove any extra betadine, and then we can call it a day, guys. And I hope this is helpful, and if you have any questions, please don't hesitate to reach out.